mean, the ones that come to my mind first are sort of maybe what some people would call the softer qualities or whatever, but I think you need to be empathetic. I think you need to be kind and gentle and flexible. You know, like you might want to have the kids sit on the exam table to do whatever, but like the reality is you might have to do it in the mom's lap because sitting on the exam table isn't happening for that kid, you know? So flexibility, I think, you know, the more cerebral things you need to do, certainly have some capacity for, you know, learning a lot of information. Medicine is constantly changing, and med school is long, and residency is long, and the hours are long. They've gotten better over the years, but it's still long. So you need to be like really, I think, kind of dedicated to that, and putting some amount of time in. It doesn't mean you need to, like, you know, have that be your whole life. I mean, there still is time for people to have relationships and families and follow their, you know, hobbies and other ambitions and stuff like that. But this takes up a significant amount of time. So you know, kind of approaching it that way. But yeah, I think it's some of those softer qualities, and then just honestly, and I think all physicians could benefit from this, but is being a really good listener. One of the best medical appointments I ever had was with a cardiologist, but he was the best listener that I've encountered in the medical setting. And honestly, just like giving people the opportunity to tell their story from start to finish without interrupting them, which interestingly enough has been kind of studied, and the average physician interrupts the patient after 11 seconds. So, but you know, especially when you're working with kids, like depending how old they are, I mean, almost all the information that you get, at least in young children, is coming from the parents who are trying to interpret what they see in the kid. And they don't necessarily know, you know, if their baby's crying, they might say to you, I think my baby has, you know, gas pain or something. And, but you have to like really listen to what they say and then help sort of draw out more information, you know, okay, well, she's crying and she's vomiting, but like, what is it about what she's doing that makes you feel like this is likely to be gas, you know, and figure out, because sometimes the parents are right, sometimes they're not right. And as a physician, like that's your job to figure out, does the baby really have gas pain? Or do they have like volvulus where their intestine is all twisted around and they need surgery to fix it? So yeah, I think that's actually really important for all of us physicians. We can get better at listening and being a good communicator, you know, because being clear, like you can have the best management plan in the world for somebody's situation, but if you don't clearly communicate to the person you're talking to what the plan is, or making sure that whatever you're recommending is something they can actually follow through on, then it's not going to happen.